Opioids are a class of medications that are derived from opium. We talk about opiates, strictly those are morphine and those that are directly derived from opium, or opioids, which are synthetic drugs that do similar things in the body. Yeah, opioids are historically used for pains of any kind, although we're finding more and more lately that they're more useful for acute pain and much less useful for chronic pain. The opioid crisis is something that we've called the opioid epidemic in the last several years, and this is really the downside of opioids, both prescription and non-prescription opioids being available in the community, and the large number of deaths and injuries that have occurred from those. This opioid epidemic is different than the ones that we've had in the past in that most people who are now taking illicit or street opioids started with prescription opioids. There's been a big shift from those people who are now dying from opioids, dying not so much from prescription opioids as from illicit drugs that are coming in, heroin and now fentanyl. But this opioid crisis is different than those, for example, in the 1970s, because most people started with prescription opiates. The pain management program at Virginia Mason really strives to start with accurate diagnosis, and then we can bring to bear medicines, but also many non-medical therapies on the treatment of pain and the associated quality of life issues that arise from chronic pain. The best treatment of pain starts with an accurate diagnosis, and then there are a number of specialists that we have at Virginia Mason who can address different elements or different domains of pain. So for example, we use medications, we use injections, but importantly, we have a team of therapists and psychologists and physicians who can address all of the different elements that bring suffering with pain. So we get people activated, we help them deal with their stress, their sleep, other things that will help with quality of life that are separate from medication. Back pain is a very common problem, and the people who do the worst with back pain are people, it turns out, who take a lot of drugs early on in the course, or who become very sedentary or become very frightened. And so we've developed a system of getting people in early and addressing all of the diagnostic questions early so that they can start a rehabilitation approach, usually on the first day that they're here. And so they can become activated, get less frightened, and they generally do very well with that approach. It's very rewarding for our physicians and for our whole team to see people do well with rehabilitation treatment. It's life-changing at times, and that's why we all went into medicine.